Good afternoon, everyone, and welcome to the staff webinar. I'm joined here, my name is Elaine Connolly, I'm the Communications Director. I'm joined by Noreen Spillane, the COO, and Lorraine Rafter, the HR Director. So this afternoon, we're going to be talking to you about a few different subjects. We're going to have a Q&A session after we do our presentations, and the option is open on the webinar if you want to start submitting your questions, and we'll take them after we finish the presentations. We've also recorded the session as well, so it'll be available to any staff who are not able to join us this afternoon. So I'm going to hand over to Noreen.
Good afternoon, everybody. So in terms of our attendances, you can see there on the graph that we have increased number of attendances in our emergency department. In 2021, we had 76,000 attendances, which was the second highest in the country, second to the Mater in Dublin. And then in our local injury units, you can see there that we have a huge increase in numbers. All three units are open 7 days a week, and we've seen a huge increase in the attendances there. And this graph just shows you the number of, or this table shows you just the number of calls that are where patients come in by the ambulance service, and they're the emergency calls and the GP calls. And you can see there in February of this year, we had 865 calls, our ambulances brought into the emergency department in this region. And the second highest after that was St. Vincent's Hospital, University Hospital in Dublin. So you can see there's very large numbers coming in via ambulance, 1,865 there for the month of February. And our inpatient discharges, again, you can see the numbers there from 2019 up to 2022, where we've seen an increase in all of our patient discharges as well across the group. In terms of our medical average length of stay and our surgical length of stay against the national average, we are lower in both of those. So we can see therefore in the medical average length of stay is 4.8, and in surgery it is 4.4. So in terms of our unscheduled care, our CEO, Colette Cowan, commissioned an external review with Deloitte, which is underway currently. And it was really to try and look at patient flow and the challenges within the emergency department and across the system, and also to determine any opportunities to improve patient flow and to look and reflect on the effectiveness and the impact of our practices. We're also consulting with the Midwest Community Healthcare and our GPs. This piece of work will be probably another 2 to 3 weeks. The UHL, or the acute side, is almost complete, and Deloitte are now engaging with the Midwest Community Healthcare and the GPs. There's been a lot of media coverage about a national HSE-ED review, and we are part of that. And we've had a visit from the national team only 2 weeks ago, and they plan to come again in the next couple of weeks. And that's really to work with us, with our plans, to see if we can do anything in the short term, medium term, and the long term. So that's a collaborative working group where we will try and improve our patient experience. We also started a new unscheduled care working group, and that's jointly run between us and the community, and we run it every Monday morning for about an hour to an hour and a half. And it's really to plan for the week ahead, look at our data and see where we can make improvements in the week coming. The CEO has also commissioned an external theatre utilisation review with Grant Thornton, and that has just started also. And the objectives of that review are to understand the current theatre usage processes, to develop a model to support theatre into the future, to look at the resource allocation and any areas for improvement, and then make any recommendations to improve the use of theatre resources, and also to develop structures to support the implementation of the report findings. So scheduled care, as you know, during COVID, many of our outpatient, inpatient and day case waiting lists were cancelled. And you can see there in each of the waiting lists, we have patients waiting the huge increase since 2019. You can start seeing a slight decrease now that we're up and running again in terms of our outpatients and our inpatient and daycare services. We are, of course, challenged with unscheduled care, and we are still cancelling patients because of our bed capacity issues. And when the unscheduled care is very busy, we end up having to cancel our scheduled patients. There are national targets in terms of our waiting list. There's a huge emphasis nationally on it. And our targets are, so 98% of patients need to be seen within 12 months for inpatient day case, 18 months for outpatients, and 12 months for GI scopes. And 100% of patients need to be seen within 24 months for inpatient day case, 36 months for outpatients, and 24 months for GI scopes. We're working with the national waiting list clearance plans also. John Doyle and his team. We work with the Advanced Clinical Prioritisation Programme, Scheduled Care Transformation Programme, and the NTPF. And you can see there under the Advanced Clinical Prioritisation Programme, so our target for this year is 13,500, and that includes the specialties listed there: ENT, gastro, general surgery, maxillofacial, respiratory, rheumatology, and urology. And we already have over 4,000 appointments booked to the end of April. And then under the Scheduled Care Transformation Programme, you can see there the expected volumes under each of the different specialties. And neurology and cardiology just commenced there in May. So our bed capacity in UHL, as you know, during COVID, we had 98 new inpatient beds added. And they have been very welcome in terms of isolation in particular, and allowing us to move patients, transfer patients from the emergency department more quickly into beds where they can be isolated, patients can be isolated. We've also opened 10 new critical care beds. However, we do need another 210 beds to meet our demand. Our new 96-bed block is currently underway in that it has been approved by the HSE board, and they're doing a lot of pre-contract work at the moment, that is estates, and they are hoping to start in the summertime. 50% of the new beds will be new and 50% will be replacement for some of the old Nightingale wards. We met the minister a few weeks ago when he came to visit. And we also raised it with the national team when they came to visit, the requirement for a hospital in the Midwest where we can do our scheduled care. As I've said previously, we end up cancelling a lot of scheduled care patients when the hospital is very busy with emergency patients. And an elective hospital in the Midwest region is something that we have requested. So our site improvements so far, we have a lovely new injury unit in Ennis. It just opened there in the last couple of weeks. We have a new gynae unit in Nina, which is really a women's health unit, and it's a regional unit. And in the next few weeks and months, we hope to develop a menopause service there with the local GP's input also. And we hope to open our subfertility hub there. The gynae unit itself opened on the 22nd of March. We have a new pain day ward service in Croom. That's a new ward that has been refurbished for that purpose for our patients. And we have our phase 1 neonatal unit has recently been completed, and we're just about to start phase 2 in the maternity. And our new MAU in St. John's, they've recently moved into a bigger area, giving us additional slots, which has made a huge impact on patient flow. Now I'm just waiting for the slide to move. So then our National Inpatient Experience Survey results is the 2021 results. So 8 out of 10 of our patients are satisfied with our hospital experience, which is an improvement on the previous survey, and patients reported high levels of trust and confidence in staff, which is very encouraging. And our focus areas are on discharge planning, communication with clinical staff, and updating patients on medication and side effects. And these areas, the focus areas, are a focus area for most of the other hospitals in the country also. So HICMA visited us on Monday, the 23rd of May, to thank the staff for their input in the survey, and also to encourage and remind people that the survey is currently underway. And there's a survey pack that we need to provide, a survey pack on discharge, and that has lots of information for patients. It's really important that we get our feedback from our patients so that we can make the improvements that they're asking us to make. So we'd encourage everybody to do that. Thank you. I'll hand over to Elaine. Thank you.
Thanks, Noreen. Okay, so this afternoon I want to take the opportunity to talk to you about our communication strategy. Over the last number of years, we've done a lot of work developing more targeted and consistent communications for all our different audiences. We took the opportunity, I suppose, to review the work that we'd done, and also to apply some of the learnings that we had from the COVID pandemic and how we communicated throughout that period. And we've put that together to develop a communication strategy from 2022 to 2024. I suppose most of us will recognise that how we communicate and how we absorb news has completely changed. We consume media in much different ways. We've moved from the traditional source of radio, TV, printed newspapers to more social media. And that has given rise to citizen journalism, which means that people go on social media, and if they have a large following, they can dictate the news of the day. So as an organisation, we need to be agile to be able to respond to those changing needs and to keep pace with that change as well. And in addition to that, staff have increased expectations about how we communicate. They want us to be, they want to receive messages that are targeted to them, that are relevant, and that are easily accessible. And we need to evolve as an organisation, as a communications team, to be able to meet those needs. So we need to look at the tools that we use, existing ones, see where we need to develop new ones, look at how we can improve targeting of our communications as well and some of our messages, and to be more responsive to the needs of our audiences. So in a health organisation, and we'd be no different to anybody else, we have very complex set of customers with very diverse needs, and they broadly fall into 4 categories. And for this communication strategy, we looked at those different categories. So we work in a very hierarchical organisation. So from the top down, some key audiences for us are the corporate, so HSE and Department of Health, the National Acute Division, the leadership team here, and people managers. And then across the organisation, we have different groups of staff, contractors, volunteers, the patient council, and then individual staff members as well. So all are really important audiences for us. But unusually, in a corporate environment, you also have quite a large number of organisations or stakeholders that sit outside the organisation but have a big influence on us, and also dictate some of the work that we have to do and influence what we do. So they would include healthcare partners, patients, the media, different representative bodies, regulators, trade unions, our local communities and charities. So really a wide range of organisations that, like I say, have an influence or an interest in what we do and what we have to say. So what we've done is to develop our strategy, really looking at those 4 groups. We want to be very audience focused. So the 4 strategic priorities for us from a communications perspective are about building, maintaining the trust and confidence in the group, empowering our staff through strong internal communications, increasing our digital focus to better connect and engage with our audiences, and then finally to leverage our partner alliances to promote the group's work and reputation. So I'm just going to take a few minutes just to go into a little bit of detail to describe what each of those means and to give you some kind of working examples of what that means from a day-to-day perspective. So when we think about building and maintaining trust and confidence in our group, the things that we want to do are to protect and enhance our external reputation. We want to promote the group as a centre for education, research and innovation, and support a healthy culture for both staff and patients. So these are a selection of things that we're going to do this year that talks to those 3 areas. So we're going to use service improvements to showcase acute services in the region. What we found, certainly over the last number of years, is we've, like everybody, been very focused on our pandemic response and our vaccine programme. And what we want to do now is to get back into a routine of talking a bit more about the services that we provide to patients and talking about service improvements. So the lymphedema service is one that we've worked with the lymphedema team on earlier this year, where they set up a trial with the National Cancer Clinical Trials Programme. So they're the kind of services that we want to focus on more this year. The gynae service is another example, like Noreen mentioned, that was launched in the last number of weeks. And we've worked with the team to try and promote that service, to raise awareness of that service across the region. And the pain service is another example of work that we're going to be doing with the pain service in Croom in the next couple of weeks. We also want to become a health literacy friendly hospital. As an organisation, we publish and we share thousands, if not hundreds of thousands, of different forms of communication with our patients every year, from appointment letters to different forms of communication. And we want to make sure that everything that we produce is easily understood by our patients. From letters we send them about appointments, to information leaflets we share with them about a particular condition when they come in for an appointment. And this really talks to the feedback that we've got from the National Inpatient Experience Survey, where they want us to improve our communications. So that really sits and talks to that area. And it also aligns to the work that's been done nationally with the National Communications Programme, which is very much focused on how we interact on a one-to-one basis with patients and the language we use with them. So they all kind of sit well together. We're also going to use local and national campaigns to tell our story. As a hospital group, our injury units are very important to us, having only one ED in the region. So it's really important that patients are aware of the services that are provided in injury unit and that we encourage them to go to those services when it's appropriate. So we've worked very much with our ED teams and the teams in the injury units to promote those services nationally, and we'll continue to focus on those over the coming months. And then finally, promoting research collaborations with UL. We're looking at opportunities to promote different events and activities that we do. So, for example, earlier this year, the NCHDs held their second conference, and we worked with the organising team on promoting the work of promoting the conference, but also promoting the research that the NCHDs had done. And then moving on to our second priority is about empowering our staff through strong internal communications. So again, what we want to do in this area is equip our staff with tools and resources to become brand advocates, to strengthen our communications and share messages and improve understanding, and to support employees to become better communicators. So again, a few things that we're doing in this space this year is we want to provide staff with facts and information on our performance. So we do that through channels like this one, our webinars, also through Team Talk. But we know we've got to get better at doing that and sharing information about our performance. So that's something we'll be very much focused on this year. We support the rollout of employee engagement initiatives, and this is working very closely with HR on different initiatives like Your Opinion Counts, and looking at how we can support them in communicating some of the messages and the activities from those type of activities. We'll develop new channels to meet the needs of our audience. So from feedback that we got from staff, we developed a new Pulse newsletter, which goes out every Tuesday and Thursday to staff, which amalgamates lots of different communications that would historically have gone through separate emails all into one email. And again, trying to improve that channel, and something we'll be continue to focus on to try and reduce the amount of emails that staff are getting. And then finally, we'll be, again, working with HR to develop resources to upskill staff in communication skills. And we've already started that process by developing a communication toolkit for new managers. And we'll be using the platform ULHG Achieve to put more learning opportunities for staff in relation to communication skills on there. And then thirdly, our strategic priority is around increasing our digital focus to better connect and engage with our audiences. So like I mentioned earlier, our audiences, they consume media in different ways, and we need to start to move into that space. And we've started to do that with our social media channels and using technology to improve and increase the reach and engagement. And this year, we'll be looking at developing a digital strategy for the group as well. So a couple of things that we'll be doing this year is producing content that tells our story and showcases our services. So we've produced a campaign called Our People, Our Services. And so far this year, we've promoted our PAL service, our renal service, and clinical trials. And that really allows us to produce short videos to help patients understand the service that's available to them. We use graphic images, so pictures of the team, a day in the life, and op-eds which go into the local media, all to help raise awareness of the different services that are available through the hospital for patients. We want to expand the functionality of our website. We were the first hospital group to have a presence on the national website. We want to continue to work with the digital team to expand that. We're going to expand our digital signage at all our sites, including our admin sites as well, and continue to produce new content for staff and for patients. And then expand and update our services directory. So we're the first hospital group that has all the services available for patients searchable on the website. So we want to ensure that we continue to update and expand that directory. And our final priority then is about leveraging our partner alliances to promote the group's work and reputation. We want to raise the profile of the group and promote its work and reputation, and also support long-term care reform. So things that we're doing this year are developing engagement plans targeted at key stakeholders. We've done a lot of work over the last couple of years around improving our engagement with our local public representatives, and we continue to work with them. But we're also looking at other groups within that stakeholder group, so that group that sits outside but influences the organisation. So looking at other groups there where we can have engagement and improve our relationship with them. We continue to promote the work of the Patient Council. We have a comms rep that sits on the Patient Council, and we'll seek opportunities to represent the patient voice. So earlier this week, you might have seen the programme Hospital Live, which ran on RTE for 3 nights. And on Monday, we had a really lovely patient story. So a patient who had surgery in UHL and then had their follow-on care in NINA. And there was a really nice piece on that programme that showcased that patient's journey. So we'll continue to look for opportunities to do that. And then also we'll work with our community colleagues on promoting integrated projects. So any reform that comes out of slow to care and through integrated projects, we'll continue to promote those. So we've designed the strategy to be flexible. We are aware that we work in a very organisation that is going through another change with the launch of the regional health areas, and we know that we need to adapt to the needs and capitalise on the trends and be responsive to the changes that the regional health areas will bring. We also recognise that we're under continuous scrutiny from the media and from public in relation to our bed capacity. And we recognise the impact that has on staff morale and on our reputation. But we're committed to positioning ourselves as a trusted source of healthcare information in the region. And we'll continue to work with our colleagues across these sites to be able to voice that trusted source of content. As an organisation and as a comms team, we want to be able to tell all the stories of the group, all our ambitions and our achievements and our plans and our people. Thank you. Passing to Lorraine.
Thank you, Helen. Good afternoon, everybody. I just want to give you a brief overview and share with you the findings of the staff survey, which was, I suppose, commissioned nationally by the National Director of HR in 2021, the end of 2021. So just in terms of the main areas, I can just come to you in terms of the work that was done at that time. Nationally, there was a total of 12,959 employees that completed the survey. And for the UL Hospitals group, we had a response rate of 12%, which equates to 658 employees across the group. And I suppose just in terms of some high-level figures, in terms of the people that filled in that survey, they were in the main, I suppose, females that completed the survey. And they were split between kind of management grades of about 259 and then non-management grades of about 359. And just then, in terms of the feedback from the survey, as I say, there was 10 areas that were concentrated on. So I'm going to give you just some of the high-level findings of the survey. So in terms of my job, most staff agreed that their job makes a difference to patients and service users. However, improvements can be made with the number of staff who reported feeling proud to work for the group. Again, I suppose some staff were not totally satisfied with the recognition that they received in their role. And we know that we need to do a lot more work in that area. There was, however, an increase in staff who reported being very satisfied with the level of independence that they have in their role. So that's a very positive, I suppose, feedback to have. Then in terms of management, this was a specific category that was looked at, and staff reported a desire to have more regular meetings to discuss their performance and objectives and to have more focus on their own development. And I suppose that ties into the whole area of performance achievement. Again, some staff were not so happy with the level of engagement and feedback that they received from their line manager. And in terms of the whole area of health and well-being, this was a particular targeted area. There was definitely some improvement in the quality of our physical working conditions, and that was definitely reported within the survey findings. But definitely there needs to be more work done to improve the workplace atmosphere. There was also a slight improvement in the number of staff who were aware of the supports that are available for staff that are experiencing stress in the workplace. I think that was up about 4% from last year, from the 2018 survey. In terms of training and development then, there was improvements identified that were needed to support staff to help them to do their job properly. And staff were slightly more positive about opportunities for career progression. Then in terms of the whole COVID-19 experiences, there was mixed, I suppose, sentiment around the experience of COVID-19 amongst our staff. Some staff found the shift to digital means of working with the service a positive experience, and that definitely, I suppose, is on trend with the way the workforce is going, nationally and internationally, in terms of people wanting to have that option to have a remote flexibility for working going forward. So then, in terms of discrimination, the vast majority of staff said that they hadn't experienced any discrimination from the public, with some small percentage of staff feeling that they had personally experienced discrimination from their colleagues. So in terms of dignity at work, there was good awareness of dignity at work policy, and that's encouraging to know. Most people were aware that we do have a dignity at work policy. And some staff did identify and report within the survey findings that they had experienced bullying and harassment at work from their manager or their team leader or other colleagues. So in terms of errors and near misses and incidents, most staff reported that they were encouraged to report errors, near misses and incidents. However, more needs to be done to ensure staff are treated fairly if they have been involved in errors, near misses or incidents. So in terms of disability, this was a particular area that was focused on. We do have a small and growing number of staff who have reported having a long-term condition which does affect them and causes them difficulties in life and also, I suppose, in the workplace. So that they're the kind of top level findings, if you like, in terms of the findings from the survey. And I'd like to thank everybody that did participate and took the time to fill in the survey. And I suppose now, in terms of the next steps, we are very much focused, and I suppose it's my commitment to the hospital group that we will put together a working group to commence a review of the findings and to look at an improvement plan to make sure that we stay engaged and make staff engagement, I suppose, a priority. An improvement plan will be developed and supported and actioned as part of that work. And I suppose we will continue to communicate progress in the months ahead. And within the HR department, we've identified a lead and somebody to lead out and support the work around that staff engagement.